Hi, I hope you find yourself very well, and I hope you know the treatment that works for you. You have found that a lot of the times it takes a while to find the treatment that works for you. For me, it's been a long roller coaster. And at the beginning of my diagnosis, I was very terrified and I did not want to know anything about multiple sclerosis for like the first 4 years. And it took me down a long path of not knowing what medication worked for me. So I'm making this video in hopes of shedding some light on some medications that actually this medication I'm going to speak about has not been mentioned in a while by a lot of the doctors that I've spoken to. Either way, when I first was diagnosed, the doctor gave me a stack of books and a stack of videos and said, go home, watch these videos, and let me know which medication you want to start on. Back then, there was no pills, there was no IV infusions that would be prescribed to MS patients, people who had multiple sclerosis. So again, I knew nothing about multiple sclerosis. I was afraid. So I was just like, okay, give me whatever works. And he was like, I don't know, just choose one. So I was like, okay, beta seron. It was an injectable 3 times a week, I believe. And it was a smaller needle. Maybe it was once a week. I can't remember. That was like almost 15 years ago. So sorry if I have some of those dates wrong. But and information for beta seron. It wasn't injectable though, and that didn't work for too long. However, I wasn't consistently taking it either. I didn't want to know anything about MS. I've never had to take a injectable either before, and also I was terrified, and I didn't always take my medication on time when I was supposed to, the days I was supposed to. So then moving forward, I had my baby for a full 9 months. I didn't take any medication. I just went ahead and was pregnant, and I was shielded by the pregnancy. That's another video. I have a pregnancy video if y'all want to watch it. But this video is for anyone that's ever been confused or that is confused now and doesn't know what approach to take on therapies, or whether it be natural medications. Everyone's different. So for some people, natural medications work. For some people, conventional medications work. And for some people, both conventional and regular just medication, natural medication work. For me, it's both. For me, I take both approaches. And the reason why I do is because I have been able to have the privilege of spiraling all the way down and not knowing what medication works for me. So then, okay, so prior to me finding out I was pregnant, beta seron stopped working for me. It could have been my fault as well, because I wasn't keeping up. I wasn't consistently injecting the medication. I was missing a whole lot of injections. And so moving forward after my pregnancy and after my delivery, thank God, healthy baby. So if anyone wanted to know that, but either way, he's now 13 years old. So thank God. I was terrified, by the way. Again, different video. But after my delivery, I thought, hey, I'm fixed. I didn't have to, I'm cured. I didn't have to take any medications while I was pregnant. So, hey, why not take any medications? So, bad mistake. By the way, so I went just AWOL. I just acted like I didn't have multiple sclerosis. And for me, that turned out very wrong. Very bad. So just in case anyone is thinking of doing that, I don't know. It's up to you, your body, your choice. But for me, it didn't work out. So 2 months after I delivered, had the worst relapse of my life. I actually found a new neurologist from the neurologist that I had before. I went ahead and changed neurologist. My first neurologist was great, but I changed neurologist. New neurologist said, okay, maybe Copaxone will work for you. Another injectable, 3 times a week, this one. And again, I'm not sure about the beta seron, but I know it was an injectable. I think it was either once or 3 times a week. Either way, I didn't keep up with it. So Copaxone was 3 times a week, and it was a 44 mcg syringe. And that worked for about 5 years. I was good, no relapses. after my 5 years, changed neurologist again, different reasons, but changed neurologist, and the new neurologist said, hey, I don't think Copaxon's working for you anymore. You're starting to experience more relapses, so let's look into another medication. By this time, the new medications were coming out, which were the pills. And Tysabri was also out, which was the infusion that I think it takes about an hour. I've never taken it, but they were saying either Tysabri or a pill. Jelenia, I think, is what she had recommended to me. But it was in the trial stages still. And they were just conducting trials at that hospital where my neurologist was, and they were about to finish the trials. And she said, but I just want to let you know that all the side effects are not yet established. We do not know all of the side effects yet, which is why we're doing the trial. I can get you into the trial as well, she said. And I was like, oh no. I was like, no, I do not want a trial. Because by that time, I knew about PML, which is an infection in the brain that you can get from some of these new medications, which include Tysabri. And I'm not sure if Jelenia is one of them as well, but there's some medications that can give you a brain infection. And either way, so I was like, no, I don't think so. So by that time, I had researched and I came across Rebif. This is the box that Rebif comes in, and we'll get to that in a minute because I don't think the lighting is great here either way. But I came across Rebif. She never mentioned Rebif to me because she said, well, I think you've already been on 2 injectable medications, which are beta medications, and they're all in the same family, so I don't think that that Rebif was such a good idea for you because maybe your body has already become immune to these medications, these therapies. So I was like, can I just please try it? Because I don't want to try the pill that all the side effects have not been concluded yet on. And she was like, well, I don't think it's a good idea. She kept fighting me, but I kept fighting her back. I was like, no, can I just try this medication? And if it doesn't work, then we'll move on. And then she was like, okay, fine. So she lets me, and this is 8 years ago. This was 8 years ago, I think going on 9 years now. Thank God that it did work. It's been working, and it's not only the medication. I don't feel that it's only the medication. I think that the reason why I thank God that I'm doing so great is because, and I have problems too. I'm not just perfect, but you know what I'm saying? I have some issues that I talk about in my other videos, but for the most part, I live a normal life. You know, I work, I'm a mom, I'm a wife, I'm good. Like, I thank God. Like I said, I feel that it's so many things that I do that help me stay active and well, because this multiple sclerosis affects your brain, your whole entire being. I mean, well, for me, from my experience. So either way, I wanted to mention Rebif to you guys because a lot of doctors haven't mentioned Rebif to me in a while. And it's kind of like an old medication, and I feel like a lot of doctors, neurologists, try to push out these new medications. And it's okay, whatever works for you. Like I've said many times, everyone's different, but for me, it's worth mentioning medications that have less side effects, even though this medication does have side effects, but they're not as horrible as these new medications, you know. So either way, Rebif has worked for me. I'm gonna see if you guys can see the box. It comes in this box here. Sorry about the lighting. Comes in this box. It's 44 mcgs as well. It comes in 3s. So this is a week supply, the syringe here. And I just take it Monday, Wednesday, and Friday. I've been consistent on it because the inconsistency also did not work for me. And I've also incorporated, of course, staying adamant with my diet, good diet, trying to stay with up to date with my sleep, at least 7 to 8 hours of sleep works for me. Find what sleep works for you, how many hours you need for your body, because everyone's different on that as well. But either way, for me, I need 7 to 8 hours. And just wanted to mention this Rebif to you guys because I feel like, yeah, this is a medication that has kind of been forgotten about. But it works for me. And so like I said, you inject in your it's self-injectable. I was going to show it to y'all. They actually don't have a pouch for it, but I'm using my Copaxone pouch that I had. And so I have this syringe that I inject with. Again, not advertising this. Whatever works for you is great. Talk to your doctor as well. But I just put this medication, and I'm going to demonstrate how I inject, or how I use my auto eject, just in case anyone wants to know. So I just hold my auto eject here. There's a little slot for this injection, and then I just simply pop it in, and it clicks, right? This stays in, it clicks. And then today's Thursday, so it's not my medication day, so I'm not gonna inject, but all I do is take this out, and the lid to the medication is to the needle, because it's the needle's protected, so you don't poke yourself. And then you just take it out, and then you place it wherever you're gonna inject. I can inject in my abdomen area, and I just click, hold down in 10 seconds and count to 10, and then that's it. That's how I inject. There's also nurses that come to your house, and I don't know if they're, because of the pandemic, I don't know if they're doing the virtual demonstrations, but usually there's nurses that come out to your house and show you how to inject for the first time. If you've already had injectables, and it should be pretty easy, but if not, and if you're afraid of needles, hey, again, find what works for you. But I just wanted to let people know that this is another option. This is another therapy out there. Like I said, even my doctor was pretty hesitant on allowing me to or prescribing me this medication, but try to be your own advocate, do your research, and I hope everyone's well and find what works for you. Have a wonderful night. I hope you enjoyed this video. If so, please hit that notification bell, subscribe, and like. Have a wonderful day. God bless.